Hey guys, so in today's video I want to talk about the phenomenon, I guess we could call it, because it is crazy how so many bipolar people fall into the same routine, and I'm one of them. It is, why do all bipolar people stop taking their meds? And it is a very, very common thing that people who have bipolar disorder struggle with. I'm not a professional, I'm just somebody living with bipolar disorder who, I don't have it all figured out yet, but I went from going to mental hospitals every 3 months, long-term hospitals, even ended up homeless, I almost lost my family, to now I have my family back, I'm a mother again, I have some semblance of a life. So, I'm not some perfect, totally reformed person, but I do have bipolar disorder and I've learned some about it. So I want to share it with you guys. Number one reason why people with bipolar, I think, stop taking their meds is the side effects. The side effects are horrible. I mean, even the little ones like gaining weight, you would think, oh, that's no big deal. I can, that won't happen to me, or it won't be much. But I literally gained 60 something plus pounds just from taking a certain medicine. And not only that, is bipolar meds can make you feel very, very foggy. So like you just feel like you can't think very well, and you feel like maybe your mouth is really dry, and then that messes with your teeth. So there are just so many side effects, and then there are the extreme ones, which I never thought would happen to me. I sound like a broken record for the people who have been listening, but I had lithium toxicity, I had to get dialysis, I have tardive dyskinesia. So those are all sometimes justifications even to say I don't want to take these meds because I don't want that shit to happen to me. So that's the number one reason, I feel. And not to be rude or anything, but we're all adults here. When you take some of these medicines, they absolutely can cause side effects with your intimate life. I mean, imagine you're a man, you're trying to get your mental health under control, and now you're having problems downstairs. I mean, if you weren't depressed before, you're fucking depressed now. And same with women. I mean, I'm trying to make light of it, but it sucks, it really does. Number two, mania doesn't always feel bad. I mean, obviously depression sucks. No one wants to feel depressed. But when you first start out getting mania, a lot of people, they feel they have better ideas, they feel that they can do more work, that they're more confident, they think they're prettier, so it helps you be more creative. And also if you're bored, and then all of a sudden you have these delusions, and you have these, like I used to see like projections on the wall of movies, I'm bored, I'm lonely, I'm depressed, I have no one to talk to, and now I have these movies to watch, movies. So it can feel like, you don't want to let them go because you like that feeling. And also for me personally, I feel like more spiritually in touch when perhaps I'm manic. I feel like I'm getting these messages, and to take any medicine would try to cover that up. And that's something I still, struggle with, like the whole good and evil thing, like the psychiatrists are bad and they're trying to block my messages from God. It can be confusing. But then it always cycles around, and it's like, it always ends up going really ugly. But I think as time goes on and you've had your disorder more time, you can learn to things to do to make it not happen so bad or not last so long. It's not just completely out of your hands, I think, for myself. I don't want to speak for other people's experiences with it, but I always think that there's something that I could do to make it better and not exacerbate it. Number 3, imposter syndrome. I've struggled with this one as well. I'll say to myself, oh, I'm doing better now. Do I really need those meds? Maybe I'm not really bipolar. Maybe that was just something I was going through, and I don't need these medicines anymore. And that's I get it. It's hard, especially when you have like a mental illness but you look normal and people are even telling you seem fine. There's nothing. What do you mean? You're not disabled. It can make you confused, and you think, I don't need that. I just need to get myself in order, pull myself up by the bootstraps. I'm a big fat fucking lazy fake, and I don't need to take any of these meds. But then, I gotta look at things logically. Like, look at all the years on paper I have of psychiatric hospitals, going to all the long-term hospitals, short-term hospitals, being Baker acted, getting lithium toxicity, getting tardive dyskinesia, seeing a neurologist, seeing a psychiatrist since 12 years old. I think it's safe to say I'm disabled. I have bipolar disorder. Why is that so hard to accept? But it is, it is hard to accept sometimes. And I'm paranoid, myself. I don't want to be one of those faking people you see online that they're just like, they're so desperate to have some reason to not have to conform to what society expects of them that they'll make up anything. And, some people do it for a check, which is a measly amount. I mean, I don't know how much they get, but for me, I would rather be working. I would not want to have the stigma of being mentally disabled just because I don't want to work. But it's just something that, I'm sure other people deal with too. And this one, some people might say, oh, it's an excuse, but it's really not. Some people, it's hard for them to get to the psychiatrist, because you have to, like, if you're mentally unstable, it's a process to, be getting a disability, getting insurance, and then getting rides there and setting up transportation. If you don't have anyone to kind of point you in the right direction, and you're not mentally really in the place to be doing all that management stuff, it can be a barrier to you taking meds, because imagine you don't have the money. A lot of times bipolar people are not the best with their finances, and I honestly forget. If I show you guys right now, my calendar is a wreck. I have to write it down on a calendar. I can't have it in my phone. I have to see it. And even then, sometimes I just can't go. I can't leave my house. I can't do it, and people think, well, it's your responsibility, and it is. And, it's no excuse, and you will suffer if you don't stay on top of your health when you're mentally ill. So, but that is a reason why, bipolar people don't get their meds, because you gotta be some sort of mentally stable to be able to make the appointments, to be able to keep up with the doctor's appointments and the insurance and the transportations and all that. It's hard. So I just wanted to make a longer type video for you guys, and I'm trying to think of things that I wanted to know about bipolar that I never knew, or that people that I know have asked. So if you guys have any questions about bipolar or anything like that, mental hospitals, mental health, you can always ask me. Don't feel free, or if you are embarrassed to ask in the comments, you can always email me, and yeah, we'll keep it private. But yeah, thank you all for watching, and I hope that we all learned something together. All right, bye.